Problems caused by excessive and binge drinking cost the community many hundreds of millions of dollars a year in health and policing resources. And medical professionals are saying enough is enough. Tomorrow, 15 experts go to Canberra to ask for changes to alcohol taxes, including higher prices for stronger drinks and a general minimum price. But the industry believes the current arrangements are complex enough and says price rises do little to curb problem drinking in the long term. Hamish Fitzsimmons reports.
The National Alliance for Action on Alcohol acknowledges it's not a good time to be heading to Canberra to talk tax increases. But the lobby group says something needs to be done about problem drinking.
43% of our young people say that they drink to get drunk. We do need some firm action, otherwise these problems are just going to get worse.
The NAAA is a group of health policy experts, community groups and physicians who want to reduce the impact of heavy drinking.
The reason I'm prepared to talk in this sort of a setting, and it's not a comfortable or common thing for a surgeon to do, is because of how constant it is as an issue.
Trauma surgeon Dr John Crozier is one of the experts heading to Parliament House to ask for alcohol taxes to be on the agenda at the Federal Tax Forum in October. The group describes the current system as dysfunctional.
Nobody really knows what's going on and why certain products are taxed more heavily than others. So we have the bizarre situation that some forms of alcohol are cheaper than bottled water.
The Alliance would like to see alcohol taxes based on strength or content and a minimum price.
With a 10% increase in price, we have a follow-through reduction in alcohol consumption in the order of 4 to 5%.
Floor price on alcohol was tried back in the 80s, and that didn't really take much effect. I think if you talk about the people that do binge drink, which are the 18 to 25-year-olds, I think what the concern is there is that they've got a lot of disposable income and they'll find a way around it.
Liquor retailers say when the federal government doubled taxes on pre-mixed packaged drinks or alcopops in 2008, it did little to curb alcohol consumption amongst the young. The liquor industry says higher prices are a quick fix rather than a long-term solution, and points to one initiative designed to deter those at the margin of the official drinking age of 18.
We've started with ID 25, which has worked very well, which is if you don't look 25, you ask for ID. And we also have the Drink Wise campaign happening on a national basis.
But the Alliance says several studies show increasing the price of alcohol does reduce chronic health problems as well as crime and violence.
As Australians, we have a very unhealthy culture of drinking. We pay a $36 billion annual cost as a nation for the alcohol-related harm, both to the individuals but also to those around.
There's very clear evidence that if you want to reduce alcohol problems, as well as discouraging kids from starting to drink and drink heavily, then price is perhaps the most important thing that you can use. Now, tax alone isn't a magic bullet.
The alcohol industry agrees with that point at least. It says Australia's drinking habits will only be changed through a cultural shift in attitudes.
We need to go back to family environments. We know we need to go back to the school environment. We had to start educating children from a very young age about the effects of alcohol and its alcohol abuse. And that could flow through to the industry as well, and also to social behaviour in general.
Liquor retailers say they'd like to join the National Alliance for Action on Alcohol's discussion, but say it needs to be about much more than pricing. Hamish Fitzsimmons, Lateline.